Hello and welcome to CGM Enterprise PM, Evaluate Your Revenue Cycle Performance. In this session, we will explore how analytics and reporting measure the revenue cycles as well as how to promote the AR process. We will peek into aging reports by provider and how to manage denials. We will learn how to calculate net income or loss per provider and how important collecting at the point of service is. During the presentation, we will suggest some best practice guidelines. Did you know that you can help to drive payment? Reporting and analytics measure the revenue cycle's performance based on financial reporting, benchmarking, budgeting, and forecasting. Key performance triggers such as aged AR, aging analysis by provider, denials overturned by appeal, net income loss per physician, and point-of-service collection rates are also indicators of the revenue cycle performance. Work third-party payer AR within 15 to 30 days of submitting the claim. Identify a staff member to be a liaison with high-volume payers to promote the process. Use any collection management reports available. The AR aging report by payers may identify payment issues such as third-party payers holding payment beyond payment guidelines. Establish policy for collecting high-dollar and older accounts. Define when an account will transition from insurance to patient pay in the absence of payment. Consider 30 or 45 days after claim was initially transmitted. A statement to the patient may prompt them to work with the insurance company. Confirm that statements are being sent if the statement process is automated. Avoid using manual holds. Explain to the patient that the system automatically produces statements. Follow the patient pay process consistently. Staff members can use scripts if necessary to promote consistency to all patients. Develop a culture through documentation in the financial notes. Establish the time frame that the account will be worked internally before it is written off or transferred to an external collection agency. Consider 90 to 120 days. If using an external collection agency, develop a method for tracking their success and comparing results. If they can collect 40% more than your internal staff, maybe staff efforts are lacking. Benchmark to evaluate the effectiveness of internal and external collections. Consider days in AR and write-off percentages. Best practice is 39 or fewer days in AR. Aging by provider, how are you doing? Keep it simple. There are hundreds of reports. Focus on what it is that you want to find out. Claim submission. Are all claims billed and submitted timely? Analyze aging. What about payer types? Can you see any problems? Look at outstanding balances by payer types. Look at the totals to get an idea of monthly billing totals. Start by comparing one payer at a time's current column. If billed and being paid correctly, the total should decrease significantly each month. Specific managed care plan problems. What about any specific managed care plans? Can you identify any problems? Run an aging report listing of all the individual payers. Do the same review as previously. Compare one payer at a time. Focus on the current column. If billed and being paid correctly, the totals should decrease significantly each month. Identify the worst accounts with the highest and oldest outstanding balances. Check the aging detail by individual patient to identify problem accounts. Start with the highest balance, then those with the oldest balances. Focus on the older balances first due to timely filing limits. Get those claims submitted. Denials management is at best proactive and diligent. Prior to a patient's visit, verify eligibility. 85 to 95% of claims are paid on the first pass or prompt an action to redirect collection to a secondary payer or the patient. Become familiar with specific codes that prompt denials with your payers. Look for areas where the revenue cycle team are repeating tasks. Develop denial analysis tracking procedures and implement interventions to correct. Avoid repeated denials. Managing denials must be done daily, weekly, monthly. Capture, analyze, and act on all denial information. The only way to eliminate the root cause of denials is to improve workflow. Create a mechanism to trap denials from all sources of remits. Organize denials into categories such as eligibility, coding, non-covered, and authorization or referrals. Analyze the data and develop workflows to reduce the denials. Determine the per-physician net profit or loss to identify opportunities for maximizing appointment slots and increasing practice productivity. Calculate the number of patient hours occupied on the schedule divided by the number of patient hours available per physician to determine the availability capacity in the patient schedule. To calculate if there is profit or loss, offset the billable hours, procedures, research or study revenue, and other revenue sources with expenses, salaries, and benefits. You can dig even further to determine exactly where deficiencies are. Collecting patient responsibility amounts at the time of service provides an opportunity to increase revenue, decrease collection costs, and accelerate cash flow. Identify any patients who cannot pay their bills and counsel them about available options for covering their patient responsibility. Reviewing and managing your revenue cycle requires applying best practices along with continuous monitoring and measuring of the entire cycle. Technology will assist you to gain the insight and efficiencies as well as identify any deficiencies. The cycle starts at the time the payer contracts are negotiated, fees are set, appointments are scheduled, and ends with the claims that are paid in full. Each step has special importance. Monitor all phases timely and share the results to achieve revenue cycle success. Now let's take a look at some areas of the application that can help with our goal of evaluating your revenue cycle performance. Are you checking the patient's insurance eligibility prior to their appointment? CGM offers real-time eligibility and batch eligibility to help reduce claim denials. Contact your account manager for more details. Are you collecting copays when patients check in at the front desk? The Create Patient Receipt option in appointment scheduling is a great tool for collecting the patient copay when the patients check in. Are any of your claims being rejected or denied due to incorrect coding? CGM Comply is a powerful tool that provides the most accurate and current coding and compliance information available. You will save valuable time and resources, reduce claim denials, avoid unnecessary rebilling costs, and assure appropriate reimbursement. Contact your account manager for more details. eMedix allows you to easily select a date range to confirm that all of the rejected claims have been worked. The Rejected Not Worked link should always reflect 0 if the rejected claims have been reviewed and corrected. eMedix now offers a Revenue Resolve feature to assist with managing your denials. This tool helps you to easily identify and control your claim denials. Contact your account manager for more details about eMedix Revenue Resolve. The Unprocessed Claims Report can be used to identify claims that have not yet been processed. This is a good tracking tool to ensure that all of your primary, secondary, and tertiary claims are being processed for all or selective payer types. Take advantage of the Advanced Collections module to automatically track your insurance denials and unpaid open items. The Advanced Collections module was enhanced with new features and options to easily identify items that need to be worked. Collectors can set their work lists to sort by highest dollar and oldest open items. The number of days to track open items for insurance and patient responsibility can be defined for each financial class. Utilize the Advanced Collections Payment Plan feature to set up payment plans for patients who need to make monthly payments on their account balance. You can also choose to print payment plan coupons to assist patients with remitting their monthly payments. The Collections Work screen can automatically track patients who do not meet their monthly payment plan agreement. The Flexible Open Item Aging Report is another method that can be used to identify all of the private open items and/or suspense open items. The Aging Report allows you to include or exclude specific financial classes, locations, providers, or insurance companies. The Claims Aging Report is a great tool to identify all pending claims for which no payments have been applied. This report can be printed for all or selective insurance companies, financial classes, or providers. The Actuarial Aging Report can be helpful to evaluate how many days it takes to receive payments for specific financial classes. If you would like additional information regarding CGM Enterprise PM and evaluating your revenue cycle performance, we offer a variety of training options such as virtual, at your location, or in one of the CGM classrooms. Call 855-270-6700 and select option 4, or visit training.cgmus.com. Thank you for your time and attention.